Frequent urination polyuria can be caused by various factors ranging from lifestyle habits to underlying medical conditions. Here are the most common reasons why someone might experience frequent urination. 1. Lifestyle and diet. High fluid intake. Simply drinking a lot of water or other fluids will naturally increase the need to urinate. Caffeine and alcohol both act as diuretics, which means they encourage the kidneys to produce more urine. Dietary irritants. Some spicy or acidic foods can irritate the bladder, making you feel like you need to go more often. 2. Common medical conditions. Urinary tract infection (UTI). This is one of the most common causes. An infection irritates the bladder wall, creating a frequent and urgent need to urinate, often accompanied by a burning sensation. Diabetes. High blood sugar levels cause the kidneys to work harder to filter and absorb excess sugar. If they can't keep up, the sugar is excreted into the urine, pulling fluids from your tissues and making you dehydrated and thirsty. Prostate issues in men. An enlarged prostate, benign prostatic hyperplasia, can press against the urethra and irritate the bladder wall, making it feel full even when it isn't. 3. Bladder and kidney factors. Overactive bladder OAB. This occurs when the bladder muscles contract involuntarily, even when the bladder isn't full. Interspinal cystitis, a chronic condition that causes bladder pressure and pain. Kidney stones. Stones can irritate the urinary tract and lead to more frequent trips to the bathroom. 4. Other factors. Pregnancy. As the uterus grows, it puts physical pressure on the bladder. Hormonal changes also play a role. Anxiety. High levels of stress or anxiety can trigger the fight or flight response, which sometimes affects bladder control. Medications. Certain drugs, especially water pills, diuretics used for high blood pressure, are designed to increase urination. It is important to consult a healthcare professional if you experience blood in your urine, pain or burning during urination, fever or back pain, sudden unexplained weight loss, frequent urination that interferes with your sleep or daily life.